Okay, and continuing medical management or aspect of patient management, uh, uh, I want to uh, talk about the medication that can, medication side effects. Some medication can have side effects that result in the desire to stop taking them, including sexual dysfunction and fatigue or feeling of fatigue, which will usually happen during the adjustment phase. Make sure to educate patient to do not stop taking the medication abruptly or discontinue it, as doing so could have a detrimental effect on the heart and other vital organs. Thinking about abruptly stopping the medication, it causes rebound hypertension, which can occur if the medication is stopped abruptly. So make sure educate patient about the rebound hypertension. Also, talk to your patient about the reporting the adverse reaction with the administration of or the antihypertensive medication to the physician. All right, question. Choose the statement that correctly match the hypertensive medication with its side effect. It's an select all that apply question. And with ACE inhibitors, assess for bradycardia. Beta blocker may cause sedation, and direct vasodilators may cause headache and tachycardia. With adrenergic inhibitors, cough is a common side effect. And with thiazide, diuretics monitor serum potassium level. So choose your answer and put it in your discussion board or check with me in my office during my office hours. Next question is also a select all that apply. As a nurse attending Mr. Johnson, what important aspect of patient teaching would you focus on with this patient? Maintaining the therapeutic medication regimen and not discontinuing the use of medication abruptly, informing about the side effect of the medication, stressing the importance of adherence to follow-up care, administering calcium channel blocker, and preparing a diet plan. Again, answer your question. All right, now we're going to cover the nursing process for a patient with hypertension or diagnosed with the hypertension. Thinking about the nursing process, we always want to make sure as the nurses we follow the nursing process for patient plan of care. In health history, make sure ask the patient about all the risk factors that you know. So when you take a health history, think about the hypertension risk factors and ask necessary question. Assess for potential symptoms that are targeted to organ damage, like angina, shortness of breath, altered speech, vision, nosebleed, headache, dizziness, and balance problem. Assess the cardiovascular, apical, and peripheral pulses. Assess for edema. Make sure to check for any edema, personal or social and financial factor. Why you need to know about the financial factor? Yeah, for compliance. So if the patient doesn't have enough money, won't be able to comply with the medication regimen, right? Because they can't buy it. So make sure to assess all these factors and communicate with the people around you that can help patient to get their medication, like social worker and case managers. And there are also some pharmacies like Walmart and Target. I've heard that they have a list of $5 medication, and if you like, go ahead and search it, Google it, find those medication, and if you think you can help a patient, those who have low income, you can help them to tell them that these medications are available at Walmart and Target to purchase. Following nursing process, we need to make sure we know about the problems that the patient may have. I have just two of the examples in here. One could be deficit knowledge regarding the relation between the treatment regimen and control of the disease process. What can you do for it? Yeah, you can educate your patient, right? Non-compliance with therapeutic regimen related to side effect of prescribed therapy, or non-compliance with therapeutic regimen related to low income, or many other things, okay? So think about the problems that arise with the compliance and write your nursing diagnosis. These are just examples of the diagnosis that you can write, or the patient's problem. Always make sure do a thorough assessment to find out about the problems as well. Other problems or collaborative problems and potential complication for the patient with hypertension are left ventricular hypertrophy, myocardial infarction, heart failure, TIA, CVA, renal insufficiency and failure, and retinal hemorrhage. So if you think about these potential complications and do an assessment on this, you will find out the problems and be able to have a goal or create your plan of care for this patient. To plan a goal, you need a goal or outcome. So for those that I wrote there, you can write as your outcome understanding of the disease process and its treatment, participating in a self-care program, and absence of complications. This is very huge one, absence of complications. So think about this and your role in there. Yes, put those on your feet and do your intervention. Educate, educate, educate. Educate your patient. Find the support system and support your patient adherence to the treatment regimen, consultation and collaboration if needed. Follow-up care, again, follow-up care and follow-up care and follow-up care. Emphasize the control rather than cure. You know that these days it's all about health maintenance, not treatment, okay? So you need to be proactive in this area. Reinforce and support lifestyle change. Again, lifestyle change, go back to that. Diet, exercise, weight reduction. And this is a lifelong process for the patient. Make sure to talk about that. I think my time is over.